All right, here we are. YouTube and Facebook Live, Instagram Live. Here we are. Thank you guys for being here today. Hope you guys are doing awesome. So today we're talking about agoraphobia, which seems fitting for during COVID. And what is the fear of crowded places? It's about people who with agoraphobia have irrational fear of entering crowded or open places or leaving one's own home or being in places from which escape is difficult. Okay, so let's get into this article here. This is from Kathleen Smith. It's a PhD, LPC. I don't know what that means. Smart. What is agoraphobia? Many of us. Many of us might become agitated when we have to take public transit or navigate a busy grocery store. But some people experience extreme fear and worry when they encounter public spaces that may be hard to escape. They may panic when they have to stand in line or find their heart racing when they find their seat in a crowded movie theater. This fear is sometimes called agoraphobia. When a person experiences agoraphobia, their life may become limited as they begin to avoid places that bring on this panic. They must deal with increasing isolation from others and experiences they once enjoyed. There is no exact cause of agoraphobia, but people sometimes begin to fear situations where they have experienced a panic attack or extreme anxiety. When they encounter them after the attack, they may find that they are overcome with worry that it will happen again. Signs of it. To qualify for a diagnosis of agoraphobia, you must experience fear or anxiety about two or more of the following situations. Just near the camera there. Okay, so what are those two situations? One, public transit, open spaces, enclosed places, being in a crowd, being outside of their home, which is probably very much so for COVID for some people. Maybe you are going through that. Hopefully this article will help. An example of open space might include a bridge, a parking lot, and an enclosed space might be a theater, a plane, or a supermarket. Additional symptoms might include fearing being alone, fear of losing control in public spaces, depending more on others to navigate spaces, anger or agitation, and staying at home for long periods of time. COVID, yes. I hope this helps for some of you guys. In the most severe cases of agoraphobia, people may stay in their home for many years without leaving. Yeah, 1 whole year and a half for some. When a person with agoraphobia fears open or crowded places, they will begin to avoid them to prevent panic attacks or embarrassing themselves in public. When they begin to avoid these spaces, this behavior reinforces their fear and causes them to increase. If they are forced to encounter this situation, they will experience intense anxiety and symptoms such as sweating, increased heart rate, troubled breathing, nausea, dizziness, chest pain, and trembling. They may also require someone to go with them. These fears will interfere with home and work life, and socializing when left untreated. These feelings of isolation and frustration can lead to depression and or substance abuse. Treatment options. Agoraphobia is usually treated with therapy, medication, or combination of the two. Antidepressants such as selective serotonin reuptake inhibitors, SSRIs, or serotonin norepinephrine reuptake, or SNRIs, are sometimes prescribed to help reduce the severity of anxiety symptoms. Cognitive behavior therapy is also commonly used to help a person change their anxious thoughts and objectively assess their safety in open and crowded places. Clinicians frequently use exposure therapy techniques to help a person gradually learn to manage their their anxiety in public spaces. Therapy can also help a person learn to regulate their stress level and utilize relaxation techniques to lower their anxiety. People with agoraphobia can also benefit from peer support groups, which can help them feel less isolated and gain the courage to manage their anxiety and overcome their fear. It's all about manageability. Very good. Sure, hypnosis and some other stuff like that, and meditation can help as well, I would imagine. Maybe that's what they meant up there. Carry on. Though it might feel insurmountable, it's important to remember that agoraphobia is highly treatable. If possible, prevention should be the first course of action. Roughly 6 million Americans will experience panic disorder in a year, and a third of these develop agoraphobia. If you have a panic attack or experience intense anxiety in an open or crowded space, don't wait until it gets worse to recruit help. Meeting with a counselor can help you learn to manage your fears before they feel unmanageable and lead to symptoms of agoraphobia. But if you already qualify for a diagnosis of agoraphobia, it definitely can be treated. Okay, guys, it can be treated there. So what are your action steps? Educate yourself. One of the challenges of overcoming agoraphobia is learning to correct your irrational thoughts of certain environments. Being unsafe with no easy way to escape. Learning how to respond to an anticipatory anxiety of entering an open and closed spaces can help you manage fear and worry. Find support. Absolutely. Millions of Americans suffer from a specific phobia, so take some time to check out what support is available to you in your community. In-person or online support groups that can encourage the outcome and entering an open and closed spaces. Also, do you feel embarrassed to tell friends and family about your phobia and how they can find treatment and support you? Okay. Thirdly, recruit a professional. If you find yourself avoiding open or crowded spaces because they make you anxious, do not hesitate to talk to your doctor or your mental health professional. Your fear might seem manageable now, but avoiding spaces over time will only reinforce your anxiety and worry. You don't have to let fear interfere with your life. You want to lead and keep you from the places you want to go. Take the first step today and recruit someone who can get you started on finding the right treatment for you. All right, which is a psychiatrist, I guess. This is where it's from. All right, guys, hope that was enjoyable and it'll help you with your fear of agoraphobia. Thank you so much. Have a great day, and we'll see you all tomorrow. And as always, please be positive out there. All right, take care. Bye-bye.